Sugan, thank you so much for your time. I know that you've had a close look at this second wave, and we're going to unpack by province in a moment. But what I want to know from you is, how bad is it going to get? Is it going to be worse than the first wave, do you think, for having a look at the numbers? And when are we likely to hit the worst of it?
Well, Western Cape is already worse than the first wave, and Eastern Cape is just as bad. So I expect KZN and Gauteng to be no different, and they both will probably surpass the first wave at some point, I assume.
Wow, that's quite distressing news. I'm going to start, we're going to bring up a graph of the Western Cape, and you've made the point already that the numbers are already worse than they were in the first wave. Just talk through what the numbers are telling you.
Yeah, so if you look at the average, it's already above, way above what the first peak was. The last 4 days at 2,500 cases each. And hospital numbers are almost as high as where they were in the first wave, and we're not even close to the peak of the second wave. So things are going to get much worse going through Christmas and through New Year's in Western Cape.
And it's interesting because we know that the Western Cape managed their hospital admissions quite well. But now you make the point that their numbers are already worse than they were in the first peak. Plus, they've got the holiday season influx. Have you had a look at hospitalization admissions and that sort of thing as well?
I'm not sure about hospital capacity in terms of, how many beds available. But obviously, with more people going to the Western Cape, it's going to put extra pressure on resources, staff, emergency rooms. And also, you need to remember that with more people traveling, there's more road accidents, which also puts more pressure on the capacity.
Let's move now to the Eastern Cape. You say a 7-day average of cases last week, Sunday, was 1,465. Yesterday it was 1,679. So, and I know nothing about math, but does that mean that we're still climbing?
Yeah, so Eastern Cape, it appears to be sort of slowing down. But the biggest worry in Eastern Cape is the number of deaths. If you look there, the third point, 1,140 deaths in the last 3 weeks. So about 20% of Eastern Cape's COVID deaths have come in the last 3 weeks. And that's a staggering amount. I mean, I've heard many stories of people being turned away from Eastern Cape hospitals because they're full, there's no beds, emergency rooms are full. So Eastern Cape, I think testing was a bit low, which is why the actual cases look low. But in terms of deaths, it's much worse than the first wave.
And it's quite interesting if we compare it. Western Cape deaths are 43 deaths a day, roughly, and as you say, 70 deaths a day. And that just, I think, perhaps in part shows us the difference between a fairly organised health system and one that is incredibly fragile. Now let's look at KwaZulu-Natal, because we know that KwaZulu-Natal and Gauteng are not as bad as the two Cape provinces. What's happening in KwaZulu-Natal at the moment?
Well, KZN is not as bad as yet, but the rate at which KZN is going up is actually quicker than the rate at which Western Cape is going up. So going through Christmas and New Year's, KZN is probably not going to reach its peak. It may only reach its peak after New Year's. And if you look at the second point, 400 as hospital admissions went up by 400 last week, which is a massive increase. And it's only going to go higher than this week and the following week.
Yes, and as you say, the deaths are still low in KwaZulu-Natal. They're at about 10 a day.
It's low because it took a while for the numbers to pick up. So it takes a few weeks before you start seeing in terms of deaths going up. So probably the Christmas week or the first week of Jan, you'll see deaths start climbing the way they're climbing now in Western Cape.
And now let's move to Gauteng, and that, of course, is the only province that is likely to see an emptying out of people over the festive season. So it might actually do a little better, and it, of course, is the richest province in the country, so it's quite well resourced. How is it doing with the COVID infections, though?
Well, I mean, there's been a big increase from last week to this week. If you look at it, the number of cases, the average number has doubled in the last week. And in terms of hospital admissions, it's only started going up last week. So probably in the next 2 weeks, we'll start seeing a spike in hospital admissions. And Gauteng will probably take a while before it reaches a peak, probably mid to late January. And we'll see deaths start happening around January. So it'll keep going up to Christmas and New Year's, as with KZN, as with Western Cape.
And it's interesting if we go back over all of the cases now, and this issue of positivity rate, which, as far as I remember, we want to keep it under 10%. The Eastern Cape is on 30%, the Western Cape 25%, Gauteng just under 7%, KwaZulu-Natal quite high, 14.8%. What does that tell you, Sugan?
It tells you there's not enough testing being done. Because if there's such a high percentage of people testing positive, obviously there's a lot of people out there who also have the virus and are not being tested. So these people are walking around freely and infecting other people. So a high positivity rate is not good because it shows that testing has, and if you look at, I don't have the testing graph here, but if you look at the testing graph, it's actually much lower than what it was during June and July. Testing hasn't really gone up as much as it should have.
So we really need to up our testing. I'm going to ask you a slightly curveball question, but I'm pretty sure you're a quick thinker. One of the issues is around behaviour change, and we're simply not seeing enough behaviour change. How do you factor that into your maths equations?
Well, that's the biggest problem when you're trying to predict, because people's behaviour is so random. So it's hard to know where people will be in 1 week's time, 2 weeks' time, individuals, where they're going to move. So that's what makes it so hard to predict where the numbers are going to go. And I'm hoping that if people see these graphs and see where the numbers are going, they'll change their behavior, because anyone can die from COVID, and you don't know what underlying conditions you may have. So the risk is there for everyone. So everyone needs to change their behavior, not for themselves, but for everyone around them also. Yeah, you make such an important point, and thank you so much for sharing your number crunching with us. And it just hits home that the figures are already worse than they were in the first peak in 2 provinces, and we're still yet to see the worst in KwaZulu-Natal, and possibly later in January when everyone comes back from holiday in Gauteng as well. And that was Sugan Naido, an applied maths honours graduate from Durban. Sugan made such a good point, it can affect anyone.